Health experts warn America is on the verge of a diabetes epidemic. The American Diabetes Association says 26 million Americans have the disease and another 80 million are pre-diabetic. But it is preventable. Joining us to talk about what you can do is Dr. Ryan Bradley from Bastyr University. Thank you so much for being here.
Thank you, Molly. I'm happy to be here.
You know, I think everybody has heard of diabetes, but it doesn't mean everyone knows what it actually is. So why don't you start just by telling us what is the disease and how do people get it?
Sure. Well, at the most basic level, diabetes is an impairment of our body's cells to make energy from the food that we eat. Usually the food that we eat is broken down into a sugar called glucose, and our cells make energy from that glucose. In diabetes, the levels of glucose in our bloodstream become too high, and that's because there's a hormone called insulin that's produced by our pancreas, and that hormone, we can become resistant to that hormone, and we can also become deficient in that hormone insulin. In type 1 diabetes, we know that there's an autoimmune process that causes damage to the pancreas that leads to deficiencies of insulin. In type 2 diabetes, which is caused by unhealthy lifestyle choices, we become both resistant to insulin as well as over long periods of time we can also become deficient in that hormone.
Why are the numbers growing so dramatically?
Well, the evidence points to changes in our lifestyle, unhealthy eating habits, limited physical activity, changes in stress, increased rates of depression, things like that are all risk factors for developing diabetes.
You talking about what leads to it sort of helps answer this next question, but to help drive home how serious it is, diabetes can lead to problems like heart disease, stroke, vision loss, limb amputation. So what can be done to prevent it?
Well, there are several important steps that one can take. I think the most important step is learning one's risk. And so if people are over the age of 35, if they're overweight, if they have family history of diabetes, I think it's very important to talk with a physician about their risk factors. There are blood tests that we use to measure the glucose levels in the bloodstream already, but I also think it's important to talk with your physicians about lifestyle factors that may help prevent diabetes.
A diet is, of course, so important. What is it about a whole food diet that can help?
Well, the evidence suggests that plant-based foods, plant-based proteins, vegetables, legumes, whole grains that are high in fiber, that these foods cause less inflammation in our blood vessels, and that it's actually because of inflammatory changes that we become more resistant to insulin, and it actually may even reduce our ability to make and secrete insulin normally. So it appears to be a slow-burning inflammatory process that really leads to some of the complications of the disease.
This is obviously very important information for people, so we want you to know. Also, if you have other questions or concerns, there will be a talk on diabetes on Saturday at 10:30. It is at the Bastyr Center for Natural Health. I know you'll be speaking there, so people can learn so much more. Thank you so much for your time.
Thank you for having me. I appreciate it.
We appreciate it too.